Okay, so we move on now with Mary Cronin. Mary's a PhD researcher at the Centre for Mental Health and Community Research Psychology Department at Leeds University. Mary is involved in this particular research because she's also a carer to her 20-year-old daughter, Neve, who has an intellectual disability. And due to her own experiences and work, Mary is passionate about creating change for carers. Mary.
Thank you very much, and thanks to Carolines, to Liam and Zoe and Kevin for all of his help today and patience. Yeah, it's a bit of a hard act to follow with all of the fabulous presentations that have come already today, but I'm here to talk about the Cherish project at the Centre for Mental Health and Community Research in Maynooth University. So I'll talk a little bit about the Cherish project, what it is, and what we're hoping to achieve with it. And then today I'm going to talk about the early findings that we have for this particular piece of research. So I'll present some of that analysis. During the survey we also asked some open-ended questions, and to be honest we were quite blown away by the response from the people who were providing care who replied to the survey, in terms of the amount of people who responded to those open-ended questions, but also the depth and the amount of expression that they poured into their replies. So I'm going to use some pin portraits to maybe show some illustrations to perhaps allow that those people who responded, that their voices be sort of brought into the room for this particular presentation. So the Cherish project, a community health-based approach to improving carers' health and well-being. So it arose really from actions on the National Carer Strategy that to date have been unmet by the monitoring group. Now the HSE would say, you know, certain small projects are going on here and there, but there has been no response that can really be considered to be appropriate on a national level. So one of those actions is the identification and support of carers, and another is raising awareness of carers' health and well-being needs among the healthcare professionals. So it's a sequential mixed methods design. The first part, study 1, is a survey to carers. So we felt it was important to just really get this snapshot of what's going on for carers currently, how are they experiencing things in the health and social care services. Study 2 then will really be the core of the data. This is where we'll be gathering qualitative data. So it's going to be focus groups, interviews, etc., with all of the key stakeholders there, so carers, GPs, public health nurses, etc. We also have had quite a number of carers who took part in the first part, which was the quantitative study, who have also put their names down to be involved for the next part. So great support from carers there, I think, but a great willingness on their part to be involved in this particular project. All of that data then we are hoping is going to go into the development and evaluation of training and supports for healthcare professionals. So today I'm going to be presenting the results of study 1, so our early findings. So we sent out a survey online. The initial part was demographic questions and also, you know, care experience questionnaires. We used 4 psychometric scales for the research. The first one, the general health questionnaire, which is commonly used to assess psychological distress. We used a stigma impact scale. We felt it was important to look at stigma because I suppose part of this is about trying to figure out how we can initiate the conversation, why perhaps conversations aren't happening between carers and professionals in the health service. The other scale we used was perceived stigma for seeking help, and then an adult carer quality of life. So it's a quality of life scale that's been specifically developed for adult carers. So our sample was 132 participants, And just to give you an idea of the breakdown there, we had 89% female and 10% male. And I suppose just to stress, this was despite our best efforts to get more men involved. So when I say best efforts, for example, the Men's Health Forum, the Irish Men's Health Forum agreed to be involved, and they included a link to the research in their newsletter. They also shared it on their Facebook page. We had male care support groups who sent it to their members as well, a local men's shed. You know, we were really hoping that we could improve on the amount of male participants, but unfortunately it was consistent with what has been found for other similar research. However, of the male participants that we did have for the first part of the study, we did find that a large number of them did actually sign up to be part of the qualitative part for study 2. So the mean age was 50 of the carers. We had a nice mix between urban and rural there, 53% urban and 47% rural communities. The mean number of years that the people were caring was 11 years. Time caring in a 24-hour period was 17 hours. Days per week caring 6.6. And I suppose just to say, there was 25 counties represented. We asked each respondent to state which county they were living in. So one of the questions that we asked was, what was the reason that they were providing care? And rather than ask them for just one reason, we gave them the option to rate the main reason for care. So for example, 1, 2, 3, etc. And I think what the graph here shows us is, it shows us the diversity of the care needs that are out there in our communities, but I think it also shows us the very complex situations that family carers are dealing with in their own homes. In addition to that, 11% of this sample were caring for more than one person. So the next thing we did was ask the carers about how would they describe themselves in relation to the person that they are caring for. I know this is something that Zoe and Liam have looked at in the past, you know, the idea of the carer label and how well we identify with it. So as we suspected, the majority of people would have described themselves as a daughter, you know, a grandparent, son, etc. We had 27% identify as a carer. However, it's important to say that care was only ever selected by itself by one participant. Everybody else would have, they were given the choice to have more than one option there. So they would have chosen something else like mother, father, etc. in addition to the care label there. And I suppose this is where I could kind of put my carer hat on for a minute and say I can definitely identify with that. My daughter is 20. She has quite a rare syndrome. She needs 24-hour care. The word care has never come into my radar. Absolutely never, until perhaps the last couple of years. Now I think, you know, part of that was, you know, I suppose reading some of this literature, etc. But also part of that was, you know, the change in the family dynamics. So her older brother's going off to university, her younger brother's going into secondary school. Things are not changing for her, so therefore things were not changing for me. I think we spoke about resilience as well today. And that's another thing, you know, after 20 years, perhaps resilience on a physical and emotional level anyway, at least, starts to wane a little bit. So sometimes, for me personally, that was when I suddenly realised, gosh, you know, this mother role here is perhaps a little bit above and beyond what I have provided to my other children, or what generally a mother role involves. And the other thing about it is that I would never have officially declared myself to be a carer, and it seems that 53% of those surveyed here, we asked them the question, would you ever refer to yourself as a carer on an official document? And for 53% they have said either rarely or never. So did the care population in this particular survey have the adequate support to look after their own health and well-being? So as you can see there, you know, so it's hard for me to see here with the light, but mostly it's not at all, or it's very little, with only just a tiny percentage there saying that they had a lot of supports to look after their own health and well-being. And yet, when we asked them, and I felt that this was one of the key questions on this survey, have you ever been asked how you are? So you will often be asked how the person you are caring for is. Have you ever been asked how you are? And as you can see, 25% are never asked there, and 44% rarely asked. A mere 3% of people being asked on a frequent basis how they actually are. So their perception then of healthcare professionals. So we asked a number of questions there. I expected, I suppose, these figures to be high, perhaps not as high as they actually turned out to be. So 61% felt that healthcare professionals rarely or never understand the challenges faced in the caring role. 51% felt that healthcare professionals rarely or never concerned for the carer's health and well-being. And 75% felt that healthcare professionals are rarely or never interested in hearing about their experiences of caring. We were also interested in seeking help. What are the help-seeking activities that those surveyed might engage in? So we asked a number of questions. Since taking up your caring role, have you ever engaged in this particular activity? So it was scored 1 to 5, with 5 being never. So as you can imagine, the higher scores here indicate less of that help-seeking activity. So I suppose just to point out some of those: talk to a healthcare professional about the impact caring is having on your own health and well-being was something that the carers rarely engaged in. Sought help from a counsellor, received regular help from your family, or attended a carer support group. So using our psychometric scales then, we assessed the overall health status of our sample. So we can see the mean score there of 22 for the general health 12 questionnaire, so that the sample was experiencing psychological distress. They were also experiencing stigma. On the adult care quality of life assessment, seeking psychological help. The general health 12 questionnaire, so that the sample was experiencing psychological distress. They were also experiencing stigma. On the adult care quality of life assessment, they were scoring in the mid-range there. But carers did not feel that they would be stigmatised for seeking psychological help based on this result here. So we did some further analysis on this, and we found that there was some correlations there, okay? So we did find that there was a positive relationship between stigma and psychological distress. So the higher the stigma score, the higher the score for psychological distress. There was also a statistically significant negative relationship between stigma and adult care quality of life. So the higher the stigma score, the less the score on the quality of life questionnaire. And we did not find a relationship between stigma and the help-seeking activities that we assessed in this survey. So looking at in a little bit more depth, we did a multiple regression analysis. We found that the key predictors of psychological distress were social isolation and financial insecurity, which were 2 of the subscales of our stigma impact scale. And this accounted for 14% of the variance in the scores for the general health questionnaire 12. Financial insecurity was weighted most, followed by social isolation. I suppose given the amount of times that the carers' financial difficulties have come up today in various different presentations, it's probably not surprising. And the other subscales, social rejection and internalized shame, were not predictors. So those are the stats. I'm sure you'll be delighted that part is over. So I'll talk a little bit perhaps about, as I mentioned earlier, some pin portraits so that we can perhaps bring into the room some of the people who responded to this particular survey. So a 60-year-old female caring for a 90-year-old mother plus a husband with cancer, caring 16 hours a day, 7 days a week, would describe herself only as a daughter, is often asked how she is, but never refers to herself as a carer on official documents. So when we asked her the question, how have supports or lack of supports impacted your health and well-being? No respite for my mother, so none for me. What do you think healthcare professionals can do to support you? They always ask, but the answer is never followed up on. So maybe a little of their time when visiting the caree could be spent with the carer. How would you feel if someone refers to you as a carer? It makes no difference. How does it feel to ask for help for yourself? I might frequently ask for help for the 2 people that I provide care for, but apart from the simple day-to-day things, help is not readily available. I have been feeling down and so far haven't asked for help from myself. If I do need to though, I don't feel confident that it will be forthcoming. And the next person is a 43-year-old female. There are just 3 of these, by the way. Caring for a 3-year-old with complex needs, so cares 24 hours a day, 7 days a week, would describe herself only as a mother, is rarely asked how she is, and has never referred to herself as a carer on an official document. So when we asked her about the how have the supports or lack of supports impacted health and well-being, having a sick child is life-altering. Everyone I know works, whereas I had to give up for the time being. My finances are low, people are afraid to mind my son, so the whole experience is isolating. I cannot remember the last time I felt relaxed. I don't sleep great and I cry a lot. What do you think community healthcare professionals can do to support you? Stop telling you how you are, such as you're great, you're strong, and so on. Stop ticking boxes and actually act like they're interested and not in a rush to get you out the door. Take the time to help you find info. This role is overwhelming in and of itself, and I find it really hard to begin to know where to look for options for supports. How does she feel about being referred to as a carer? Nobody has ever, so I'm not sure. I'm a mother. How does it feel to ask for help for yourself? I find it hard. I don't think people want to hear it. I think others will feel I'm using the role for sympathy. And finally, a 43-year-old male caring for a 6-year-old with intellectual disability and autism spectrum disorder. 14 hours a day, 7 days a week. Describes himself only as a father, is never asked about how he is, and has never referred to himself as a carer on an official document. So his response to the question about what community healthcare professionals can do: ask about my health and well-being, let them start the conversation, offer support rather than waiting to be asked. How would you feel if someone refers to you as a carer, like less of a parent? How have supports or lack of supports impacted your health and well-being, anxiety and depression? How does it feel to ask for help for yourself? I don't ask for help for myself. So those are just an example from 3 of the respondents. So in conclusion, our carers sample were experiencing moderate psychological distress and stigma. Stigma was positively related to psychological distress and negatively related to quality of life. And social isolation and financial insecurity were found to be predictors of psychological distress. The carers in this particular sample did not feel supported or understood by their healthcare professionals. Most participants did not descriptively nor formally identify themselves as a carer. So we feel the findings support the incorporation of a role for healthcare professionals in supporting carers and the inclusion of this in the National Care Strategy. However, it's not really enough to just put it in the National Care Strategy. I think there's an important need for education and training, projects like the Cherish projects and others that can feed in to a way to support healthcare professionals so that they can provide the adequate supports to carers, whatever that may be. Thank you.
So, statistics is really coming back to bite me. I thought it was gone, but it's not, it's still there. Any questions there now from any comments, observations, anything? One thing that struck me there is and it's kind of feeding into what we have suspected within Caroline's, is that the CSO figures for carers is way off. If you have 53% of people said that they didn't consider themselves to be carers.
Yes.
So the figures are way off. I mean, do we know
I can
how
say
way
something
off
I've
they
personally
are?
never done is
It's tick the box. What was it, question 22 or something like that?
Mm.
You know, so it really just reiterates the importance of doing that, so that the figures can be used to get supports and things like that. I think the Scots actually have it better. You guys, somebody somewhere said that there was better figures coming out of Scotland. That just
I'm not sure.
that the mushes of my brain, or
I would say we still have the same difficulties with people not wanting to identify as being a carer for exactly the same reasons that you've presented, and that's why I was saying earlier we could spend actually a whole day or even a whole week trying to grapple with that. And actually I think there's a question about, and I don't know what you think about it, Mary, about whether we should be expecting people to identify as carers when they don't want to.
Oh, absolutely. Yes.
If they don't want to, then how do we
And is it a difficulty around the language? Because sometimes it's how something is presented, and I suppose that's why I wanted to look at it in this research, because there would be little point in going to healthcare professionals and saying, okay, you need to interact with, when the first person they mentioned the word carer to kind of says, I'm a mother or a husband here, I don't fit into that. So I think that whole thing around the language has to be teased out a bit in order to get proper stats, proper figures around caring, but also in order to be able to comfortably have those conversations.
Sometimes it's probably fear, like of the,
It is.
in my experience, like it's fear of being people getting involved, and who will get involved in the family. They say that you're a carer and you need help.
Exactly, absolutely, and I think there's, because when people are caring for a loved one as well, there's that connection to the person, that you're their mother or their father, and there's a sense of, as one of the respondents said there, does it feel like it's lessening that role then, because that's the way we primarily see ourselves. But I think with a bit of collaboration there must be a way that we can get around this whole thing around the language. And I still wouldn't identify myself as a carer. I'm a mother, but I'm also a carer now. I see that, but I'm a mother who has a daughter with additional needs, but that doesn't change the fact that I'm her mother, So I think we will hopefully be able to delve into that a little bit more as well, in the qualitative piece, because I think healthcare professionals, if they were asked, would quite likely not see me or other people like me as carers either. I'm the mum who brings the young person in for their appointment.
That was actually a point that I have there as well about the healthcare professionals. I had a really interesting conversation a couple of years ago with a good friend of mine, senior social worker in one of the major Dublin hospitals, and we were talking about Care Alliance and and his comment was, why do I not know about you guys?
Yes.
I kind of, only you can answer that. And I was shocked that as a senior social worker with 35 years experience, he didn't know that there were organisations looking after carers. So therefore, did he not have it in his head that there were carers as well?
And this is another reason I think
to
that the conversation doesn't happen, is that people, why would you bring up a conversation with someone if you don't have the information to be able to give that support then afterwards, you know what I mean? So I do think, in fairness to healthcare professionals, despite what a lot of these figures say, I think if they had the information, they would do a lot more with it.
Yeah, that was really interesting presentation. I work in social worker and learning disability, and your comment there around asking people how they are, and it's in the social work role, that's kind of our role, asking families, but a lot of the time you're asking, but you can't deliver. They're usually saying, I'm not, I'm struggling, I need more help. And you know, they tell you how you are and you acknowledge it, but you can't actually follow it up with any supports because there's not enough out there.
Okay, so the lack of supports is a barrier in that case for your
you're very afraid.
your role
It's
with the
really
families.
and,
Yeah.
it's really hard because
Yeah.
it's
And I
so
suspect
bad.
that on the second study here that I'm sure we will be receiving some of that feedback as well.
Sexual
Yeah.
austerity, you know,
Yeah.
you can't offer anything. So it's very hard for the carer expressing that, and then they tell you how they are and they can't actually get the support that they need.
Yes, and I suppose you know, the healthcare professionals that we encounter might not always be able to offer the support themselves, but I think, you know, the view as well would be to give them the information so that they could maybe refer you on to somebody else. Okay, I'm sorry, I can't help with that particular problem, but perhaps, you know, that people are given information about what's going on in their communities that might be of support to carers.
And a lot of the time, you know, what people are saying, you were saying about the financial aspect as well, it's interesting that I'm not getting that very much in my area. What people are saying, they're not asking for a higher carer's allowance or respite care grant. What they're actually saying is, I want more respite. There needs to be more respite beds, there needs to be more home help, more day respite. You know, they're coming up with a practical, they're not necessarily looking for more money, they just want more practical help.
Yeah, exactly.
So it's
Yeah,
interesting
and it's interesting as well that you say that, because a lot of those things actually feed into, you know, like even as Deborah was presentation highlighted, that when people are providing significant care needs, it prevents them from actually getting out to work. Do you know what I mean? So having extra support with care and extra respite and stuff like that can actually financially impact on a family as well, because it opens up the opportunity for the people who are caring in that family to step out into the workforce too. But you can't do that on like 2 hours a week, or as you say, if your child is sent home from school, which, and by the way, when as a parent of somebody with a disability, once they get into adult services, my daughter has a service till 3 o'clock, so it's the same as really having a child in junior infants. You know, you have to be there at 3 o'clock, or you have to organise care, you know, for her. Yeah.
Oh, you were going to
I was just going to say, from a personal experience, and so often I hear with other people that, you know, because care is kind of offered, say in my case was with my mum, that it might be start with such a minimal amount, you know, of care and just a little bit of help here, there and everywhere, that you don't just, it doesn't kind of land on you for a lot of people that, you know, just overnight your care, that it's something that kind of builds up. And I suppose if it is someone like a parent, if they've done so much for you when you were a child, that you almost just feel like you're giving back a little bit, and you don't again see kind of yourself as care.
Yeah.
But what we find is, you know, even with a lot of people, if there's a reluctance to get a diagnosis, you know, of whatever condition, being dementia or whatever, and the supports and services can't come then because you haven't been given that diagnosis. And it's the same with the carer, that if they don't self-identify as a carer, then they can't get the supports and services. And like we heard, I think it was from Nikki earlier, that when she was caring for, I think it was her grandmother, that because she didn't get you know, self-identify as a carer, she wasn't able to get supports and services, and looking back, she regrets that. And I think that's, you know, to be able to keep yourself caring, I think, you know, that title kind of, even if there's reluctance to take it on, I think for a lot
exactly.
of people
And I think sometimes it's how things are presented, because I would have said the same, you know, because I suddenly found myself kind of 18 to 20 years later saying I could do with a little bit of help here, you know, but I didn't know where to go for it, or where to look for it, or, you know, what organisations were out there or anything. Yeah, so it's and I suppose the same, you know, if I could just draw an example from respite, I never asked for respite, never had respite, never, again, was something we just coped ourselves as a family, until somebody in Neve's service actually suggested it to me, but presented it to me in a way that, okay, she's an adult now, wouldn't it be nice for her to spend some time away from the family with people her own age, and it'd be good for her and it's good for everyone else. And when it was presented to me that way, I was able to let go of it a little bit then, that guilt and that kind of, you know, I don't think I could do respite. So yeah, on that basis, you know, we did do it. So and I think it's all down to the way that person I met in her support service, she was the manager her day service at the time, and it was how she presented it to me that allowed me to, you know, and I think, so I think we can find ways around it all. Hopefully. And I think there's a lot I know going on around dementia support groups and disability support groups, etc. And Family Carers Ireland do groups as well. But I think it's really good to, you know, even just to have a space that sort of anybody can go, really, I suppose, you know, because what I find is that things change. You know, one minute you're part of the parents of the child with a disability in school, and next minute you're part of the parents of the adult services, and you know, you're sort of moving from one thing to another without that. But I think within our communities there is a willingness, and so it's just, you know, hopefully what this is about is to find out what are the barriers there, and improving things a little if we can.
Okay. We'll take one more. I'm getting the from the back there. So we'll get one. We'll take
Are we in trouble,
more.
Zoe?
No, I don't drink your coffee, but I know the people are
Sorry,
really
Yeah,
I'm getting worried about that rugby tackle that was mentioned earlier.
We'll take one more here. Oh, you're okay.
Oh,
Right,
yeah.
Okay.
backing me up.
Right.
All right.
She just had coffee.
I know, yeah, exactly.
Deborah, if you could just join us here for a second as well. What we do normally at the end of these, we have something for the student presenters, and there's only two, so we couldn't say eeny, meeny, miny, mo. So what I'm going to do here now is pick a hand, pick an arm. That one. There you go.
Thank you very much.
Thank you very much, both of you, for your really, really good. Thank you.